make an initial statement.
Thank you very much, Laskin Corla, for allowing me to raise this very distressing and sad case on behalf of the Garvey family in Dundalk in County Louth. David Garvey is a young man. He's only 33, and he suffers from a very complex condition called locked-in syndrome. That leaves David completely paralysed, apart from control of his eye movements. He can't move, he can't speak. His only form of communication is through blinking or eye gaze. And despite this dreadful affliction, David is fully conscious and able to think and reason normally. His condition requires a high level of medical attention, and he's currently receiving care from the excellent staff at Beaumont Hospital, but the Minister's fervent wish is that he be allowed to leave hospital and be nursed in his home in Dundalk. In January, David was delighted to hear that the HSE had in fact approved this request, and indeed the required funding of 250,000 euro, which would enable him to go home. However, this was in effect overturned, and the HSE now claims that the cost would be in the region of 400 to 450,000. What I'm interested to find out, Minister, is how we can have two such wildly varying figures in the space of a few weeks, and indeed which figure is accurate. David's case, I think we would acknowledge, is quite a tragic one, and is a very sensitive one, and deserves, of course, the most sensitive care and attention that we can possibly give it. Perhaps, though, we should reflect on David's own words to the HSE, which he wrote with the aid of his family, holding up an alphabet chart. With your deference, I wish to put that on the record. And I quote, "Can you please close your eyes and imagine lying in bed, not being able to move a muscle and being hooked up to a life support machine? Imagine when you open your eyes, the first thing you see is a ceiling. And you will see that same ceiling for the next few hours until a nurse comes and moves your head. When your head gets moved, your next view is a wall with a mirror and a sink. Believe me, this will be the highlight of your day until your family comes at 3 p.m. to visit. Now imagine you have an itch and you can't move to scratch the itch, and you can't tell anybody because you can't talk. You can't even wipe your eyes if they get sore or dry. You can't move your legs if you get a cramp. Your family will try and keep your spirits up and try to make you laugh. They will read the paper and tell jokes and tell you about their day. That's the hardest part, knowing that you are not part of the family anymore. When they leave, you try and not let them see how upset and miserable you are. That's when your tears will come. You can't even wipe your eyes until a nurse comes and does that for you. I just want to go home. Please let me go back to my family for somewhat of a normal life. Let me plan my wedding. Let me have happiness." Now, it took David 1 week to write this letter, a letter that has taken me 1 minute to read aloud to the Chamber. Minister, I think that David Garvey and his family and his fiancée are entitled to some happiness, and for this to be brought to some kind of a satisfactory conclusion and to allow him to go home. And surely it's not beyond the ken of the system to allow that to happen. Now, I know that the family are very appreciative of the support that they've received from the HSE and from Beaumont Hospital. That's something I want to put on the record. Now we are asking for this to be brought to some kind of a satisfactory conclusion where commitments that were previously made can be honoured, and David can be allowed to come home to be cared for by his family and by the staff of the HSE.
Thank you, Laskin Corla, and thank Deputy Nash for raising this issue this afternoon. The individual at the centre of the case raised by Deputy Nash has displayed tremendous tenacity and bravery in dealing with his condition. I must also acknowledge the devastation of his family and of his fiancée at his diagnosis, and their incredible commitment to him on a daily basis. Locked-in syndrome is a challenging condition in which a patient generally retains cognitive function but requires constant clinical care, treatment and supports such as ventilation. It must be acknowledged that in this case the individual's needs are particularly complex, and patients with such needs are generally cared for in an intensive care setting. His post-discharge care would involve the provision of appropriate medical devices, such as a ventilator, which are essential to his survival, and 24-hour specialised intensive care unit nursing care. Given the complexity of his care needs, to be cared for at home, the individual would need an extensive home care package, including 24-hour specialist nursing care with clinical governance by an appropriate consultant. I understand, Laskin Corla, that several multidisciplinary meetings have already taken place at local level between the family, the HSE and Resilience Ireland, a company which specialises in specialist advanced home care management. I have also been assured that there has been significant engagement between Beaumont Hospital and the local community care services in an effort to find a solution appropriate to this patient's needs. Whilst it may be possible to provide such a solution, the equipment, staffing and resource required are likely to be very substantial and would have to be accommodated within the overall resources available to the HSE for disability services. So this case must be considered in that context. The Department of Health has discussed this case with the HSE, and a meeting between the family and senior officials in the HSE has been scheduled for early next week to discuss and consider the patient's request to transfer home from Beaumont and the significant complex issues associated with such a transfer. The HSE will continue to explore with the family all options for future care, including alternative community service providers or the individual's possible move to a hospital closer to home and family.
Thank you very much, Laskin Corla, and I want to thank the Minister sincerely for his reply. Certainly was quite enlightening. I'm glad to see that the HSE is committed to meeting with the family next week, and I did want to record at the outset the family's thanks for the support that they have received to date from the HSE. Local HSE officials are on record as stating that there is a national fund for emergency cases which the National Director of Social Care, as I understand it to be, will utilise over the next 12 months. Now that's a direct quote from a letter received by the family from a local official. And just to give you a sort of timeline in terms of how things have changed, Minister, the same local official then went on to say that, I quote, the process to access the funding has not yet been agreed. And he further insisted that he will continue to advocate for David and for the family at national level. But in a subsequent note to me from another official who is, I think, acting in the same capacity as the official to whom I previously referred, the cost of bringing David home and having an appropriate home care package to fulfil his needs seems now to be oscillating between €400,000 and €450,000. Now, notwithstanding the reference made in letters from the HSE to the family about the existence of national emergency care package or that funding stream, you seem to say, and I seem to recall you saying in your own contribution, that the budget for the care of David would need to be met through the disability service budget available to the HSE. Now, that official also makes the point that David's care at home would have to be led essentially by a respiratory care consultant attached to the Lord's Hospital in Drogheda. Now, as I understand it to be the case, that respiratory consultant is no longer in that position. So that, I think, further complicates matters from the HSE's point of view. So just in conclusion, if I may, Minister, I think there are fundamentally two questions really that need to be responded to, and I appreciate that you may not be in a position to respond to those today. And the first question really is, will the HSE locally and nationally commit to providing the funding necessary under the emergency care scheme to David? And secondly, if it is the case that there is not a respiratory consultant in place at the moment to deal with his care needs, will that respiratory consultant be appointed shortly to meet David's needs and indeed the needs of others in the Louth-Meath area? And I appreciate you may not have the answers for those particular questions today. I understand that entirely, and I appreciate as well that I'm sure you'll be as moved as I was at David's particular story and the challenges involved. So if you're not in a position to answer today, I fully accept and appreciate that, but I will ask you to commit to having the HSE to correspond with me and the family in the coming days to outline the process in relation to that emergency care fund and indeed the position as regards the appointment of a respiratory consultant who could potentially look after David's needs.
Final reply, Well, I think, as the Deputy acknowledges, I'm not in a position to respond to the specifics of those two questions that the Deputy outlines. I mean, they're not unreasonable questions, but I'm not at this point able to respond to them in the kind of detail that he perhaps would hope, particularly in relation to the various personnel involved. But I would simply just say this and repeat that the Department of Health has discussed Mr Garvey's case with the HSE with a view to senior officials having an early meeting, as I mentioned, with the family to develop a plan for their son's future care. And that meeting is to take place, as I understand it, or there's been a commitment made for such a meeting next Tuesday, the 15th of April, which would be, will be attended by Mr Pat Healy, who is the National Director, relevant National Director of the HSE, a very senior official in this area. So it seems to me that that would be an appropriate opportunity for the family, Mr. Garvey himself, and perhaps the deputy on their behalf, to seek perhaps more specific responses on the question that the deputy raises this evening. But you know, there's no doubt that there is a significant resource commitment associated with the proposed move. I'm not aware of the fact that there are two different estimates, as the deputy has outlined. That's something also that could be pursued. It is as has been acknowledged. You know, the needs involved are complex, and generally, in circumstances such as this, a person is cared for in an intensive care setting. What's proposed here, therefore, is something that needs to be pursued in detail with the HSE, and next Tuesday's meeting would be the right place to do that. Thanks.
Good morning, Dara. The next item, the Childcare Capital Programme.